fell backwards onto her right there.
And she slipped back 2 steps, like that, to the floor.
She had her leg flexed, and she fell on a flexed leg.
Yeah, apparently. She was taking a step up. And if I take a step up, I know what happens to my foot. It goes like this. All right?
Right.
And now,
that leg slipped
this
out.
one slipped, and this foot slipped and hit that upper one. Now look at the pelvis.
Right.
Okay? And then she went down 2 steps. Right?
On her backside.
She fell backwards 2 steps.
And hit the floor. So what might have happened in this position is as she went down, she tilted and
So
and
she was off
Jammed.
balance and went back.
that's what probably, that and some probably direct
Hitting on
pressure
on the stairs.
probably hit and broke the rib. Which rib?
8.
1, 2, 3, 4, 5, 6, 7, 8.
Wasn't it on our right side?
Yeah, I think it's her right side.
This is right, and then
Well-
this is more right.
So she was.
6, 7, 8.
Sorry,
So
come
in
on.
fact, she
Alright.
broke
No, Josh, you
this one, which is a little higher up, right? And as a result, depending on how far the break allowed the rib to collapse, it could be a pretty noticeable indentation.
And the bleeding would just be from the cutaneous vasculature.
The
Is there a
intercostal
blood
artery.
supply? Yeah,
Oh, sure. Yeah.
okay.
But there's nothing serious running through that area.
But it's not like the aorta aneurysm
Or the-
that they were
No.
worried about in that.
Okay, now, we've got to deal with what appears to be also sciatic nerve involvement. And we were talking about, where?
The greater sciatic notch is there.
Okay? And where is the last disc? You can see it there. Okay.
L5, that's one.
Yep.
The L5.
Now, if that goes, what's most likely to be affected?
Hopefully F1.
That's one L4.
Yep, you got it. Both. L4 and S1.
Where does the spinal nerve for the sacral region, where do they exit if they're coming out of the sacrum, that they would be affected by a compressed disc?
They
What's going to happen to
exit.
this? If this goes,
It collapses.
it's going to collapse and it's going to go this way, right?
Right, and then the nerve is coming out of here, right? So
Pinch on the nerve.
And that coupled with the fact that this hip was torqued to the right, okay, makes it even more likely that the force is going to be transmitted downward and in.
and to really
Get a hold of
Because her posture is going up the stairs is going to be like this, right? So as she goes down,
It's odd that she fell forward and then back.
Well, what is she?
Well, because if she's stepping up and it slips and she goes down like this, like it comes off of the step, she hits boom and then falls back this way.
or anybody, yeah, and raise it. What's,
She's not that much.
Yeah, I can do that.
Yeah, I can raise that.
Not voluntarily.
why should there be pain?
Because it's right where the impinged nerve is running through, right?
And what is that passive raising of the leg doing to the tension on the nerve?
Increasing it.
And if we're correct in assuming that with the loss of that disc, we're now just hard surface on nerve, it doesn't even possess the normal level of elasticity that a nerve might have. You can pull it a little
Because
bit.
it's got a lot more tension.
It's hard tacked to the bone. So as you raise that leg, you're getting the sensation of ischemic pain all the way down the nerve.
Could somebody actually physically show where the nerve's coming out?
Okay, it comes out, guys, it comes out the back here because you basically got, my understanding is that if you take across
out these holes?
it comes out the holes, but I think that it actually comes out posteriorly and basically crosses through here, okay, and runs into there.
Comes out these and then comes back in through here
So I understand,
and then
there
down
are
here.
The ventral
rami,
come out.
there are rami that come out in both directions, but my understanding is that the ventral rami are contained within the pelvis,
Oh, okay.
and the ventral rami actually exit,
The dorsal.
wrap around through, or dorsal rami, wrap around, come through the greater sciatic notch, and come down into through here,
Oh, okay, into here, they don't come through here, they come
through there,
they come anteriorly
like that.
across the,
Sorry, that's a kind of a crappy way to. I'm all feeling up the skeleton.
The other intriguing thing, and the thing I think it would be wise to remember, is that we've got pain shooting down the leg in exactly the pattern of the sciatic nerve.
Yeah.
What is that telling us?
Sciatic nerves affected.
Well, are there no nociceptive nerve endings on the nerve sheath of the sciatic nerve? Pain-sensing nerve endings.
It's a mixed nerve, right?
Well, but think about it. What would you suppose based on this symptom?
If she's feeling pain, yes.
Yeah, ischemic pain from occlusion of the nerve bundle and cutting off circulation to the nerves. So that we're getting ischemic injury of the nerve sheath right along its entire length. That's why you would see it along its entire length.
Doesn't the sciatic nerve recede it?
It's also
like
yeah.
Enough actually
Feel like
looks like that.
flexion.
I've actually been watching Craig for
Oh,
I don't think that's normal. I don't think you're supposed to be able to move the different pieces like that.
No, that's part of it.
But there's some movement there, right? There's some movement in your pubic.
Yeah, because otherwise, I thought it was part of the
It's the movement one, yeah.
Kirkford is pretty nice, but it's kind of more like a British
I
drawing
thought in his joint.
in your face.
Which one?
Yeah.